Well, pediatricians in Canada are calling on all levels of government to release some more timely data on children's flu numbers. Now, according to an article published this week in the Globe and Mail, Ottawa has not put out any data on how the flu season is impacting pediatric patients across the country. Now, the alarm is being sounded in part because at least 2 children in Canada have died after contracting influenza in recent weeks. So joining us now to discuss this year's pediatric respiratory virus season is pediatrician and the founder of Kid Crew and frequent contributor to Breakfast, Dr. Dina Kulik. Dr. Kulik, appreciate your time this morning. How would you compare so far this pediatric flu season as compared to years past?
We are certainly seeing a lot of viral illness this time of year, more than I remember seeing in the past, despite having so much flu and COVID and RSV last winter. It seems that the numbers just keep rising and rising. We've seen a lot of sick children at Kid Crew in the last couple of weeks.
Does that suggest to you that people just aren't getting their children vaccinated against the flu, or what else could be at play here?
Absolutely. We know that vaccination for flu and for COVID is very safe and is very effective at preventing severe illness in kids. And the rates seem to be lower this year than in previous years. And there's many more viruses circulating. And in some cases, kids are getting multiple viruses at one time.
I know anecdotally at my kids' schools and activities, there have been sort of like 6, 7, 8 kids at a time in some cases that haven't been there suffering from one sort of respiratory illness or another. Now, we talked in the intro, Dr. Kulik, about concerns over the availability of public data on pediatric flu season so far. Do you feel as in the dark? Do you have those same concerns? And how important is it to have that data available to doctors?
I think it's very important to have the data. What are we really dealing with? What viruses are we dealing with? Are they vaccine preventable, like flu and COVID? Are they other viruses like rhinovirus or RSV we don't typically have vaccines for? The data is really important. Plus, certain viruses have a propensity to make kids more sick than others, like flu, like RSV. Without that data, it's hard to provide a lot of advice to families.
It's got to be difficult. I mean, to be in your position, have people asking you questions and, I guess kind of struggle without the data to have the proper answers. We know 2 pediatric flu deaths, for example, in Canada this season so far. How common is that for a country like ours?
Unfortunately, every single year there are deaths from influenza, which for most kids and adults is a pretty benign illness with fever and runny nose and cough, these kind of symptoms. But for some kids and older adults in particular, it can have a high risk for some of causing really severe illness and even death.
Okay, so with that in mind, what should parents be doing here? Should we automatically, book an appointment with their doctor or head straight to the walk-in clinic if flu symptoms are surfacing, or what's the advice?
I always recommend that if kids have high fever, if they're not drinking enough, if they're having difficulty breathing, it's worthwhile, checking in with your doctor or going to the emergency room if things are really in a bad place. Most of us are seeing lots of sick kids in person again, unlike during the early days of COVID. And it's always worthwhile touching base with your physician and ensuring that they're breathing well and they're drinking enough. And if there's anything we can do to remedy their symptoms, we can offer that.
I'm curious, Dr. Kulik, can you have flu and not have a fever? Are there other ailments that are more indicative potentially of the flu, but there may not be a fever involved?
There's a lot of overlap between influenza and other typical viruses like rhinovirus or RSV, COVID. There's a lot of overlap with these illnesses with fever, sore throat, runny nose, coughing. A lot of gastrointestinal symptoms are going around with the current COVID strain as well. So there's lots of overlap. It's impossible for any given virus for us to say it's specifically this or that, because there's so much overlap. And,
it's interesting, when our kids went back to school, sort of in the wake of COVID, in those months after schools reopened, there was so much of a focus on hand washing. But I've got to even admit with my own kids, I'm kind of back on them on that. That's such a simple way to sort of try to prevent so much, isn't it?
For sure, but most of these viruses are respiratory viruses and they spread by droplets. So someone coughing or sneezing in the environment, 100% washing hands is still very, very helpful, particularly for certain bugs that cause pink eye, which is also going around a lot, or stomach flus. But when in doubt, staying away from sick people, wearing masks when you can, and keeping distance, because a lot of these spread through coughing and sneezing because of distance.
Yeah, absolutely. Okay, always appreciate the check-in. Dr. Dina Kulik, pediatrician and founder of Kid Crew. Thanks for the time here on CP24 Breakfast this morning.